Hi everybody, welcome to BD Nurse e-corner channel. I hope so that you all are excited on what we are going to see today. Yes, we are going to see a new and essential topic which is very familiar. So you may ask me one question, what is this? You're asking me new and you're saying it is an essential topic. It can't be a new topic, might be in our day to day activities as a nurse. We do this procedure, that is IV cannulation. So, I'm not going to waste your time by explaining about the IV cannulation techniques as we all are well known. So, let us go into the deeper insight of what are the parts of IV cannula. So, yes, today I am also so excited on what we are going to see is the parts of the IV cannula. So before going into the parts of IV cannula, I would like to say that a cannula is particularly it is an intravenous cannula. This cannula is a very much a flexible device, and this is very thin in nature, and this is mainly being designed for medical professionals, especially all the healthcare workers use this IV cannula in our day-to-day activities, especially when we are administering the fluids to the patient, or might be in case of medications to the patient, or blood products directly into the patient's bloodstream. So you all may wonder what is this IV cannula parts is going to be dealt with. So understanding, being the healthcare worker, understanding the parts of IV cannula is mainly crucial. So thereby we can get deeper insights of what is the main functionality of this medical marvel. So next we can see about the lower log plug, that is the first parts of the IV cannula. So when you open the IV cannula, be very generous that as we all know that we'll be doing the hand rub and you will be doing it in a sterile environment, you need to wear the glove. But as I told you earlier, we are not going to deal with the IV cannulation, but I'm just explaining about the parts of the IV cannula, so please excuse me that I'm using a bare hands, not the glove, and I would like to use my pen as a pointer. Yes. So dealing with the parts of the IV cannula. So now we are going to see about the lower log plug, which is the white one, which you can see in the external one. I would like to come closer to the camera. Yes. This white part we call it as the lower log plug. So this lower log plug, you may ask me why it is very essential. Yes, when you open the IV cannula, you have the cannula as well as the needle. But you may dream like why this cannula, this adapter, or you call it as the lower log plug, is very essential. Because this is actually connecting a link between the IV cannula and the infusion system. So always we know when the patient is being on blood transfusion or might be medications or IV fluids, we always open this port and might be after putting into the patient's bloodstream, you can see that this hub will be closed with the help of this lower log plug. So this plug is acting as a tight and leak-free seal in especially when the patient is preventing in case of any inadvertent disconnections during medical procedures. So when we need to mobilize the patient or when we need to transfer the patient, what we do is that we close this with the use of the lower log plug and then we transfer in order to prevent the leakage of the blood from the IV line. Yes. So next we can see about the flashback chamber. So the flashback chamber, so I would like to hold the lower log plug on my hand. So this is the flashback chamber, just very close or next to the IV, that is the lower log plug. This portion is your flashback chamber. So here you can see a needle as well, very close, and there is a small portion which is being, as soon as the line has entered into the vein, that is an immediate flashback phenomena. So you may ask me why this is very essential. Yes, they have structured or they have beautifully devised in such a way to analyze whether we are in the right vein. So this flashback chamber is nestled with the hub. So you can see it is very attached with the hub, and this is acting as a transparent reservoir that will be visually confirming the successful vein entry by displacing the flashback of blood. So this is a very crucial feature that empowers the healthcare workers, especially the nurses, with real-time feedback during the cannulation process. So I think like it's very understandable. Like immediately when we enter into the vein by the Zenne's technique, you have the flashback phenomena in the flashback chamber, which shows that we are in the right way. So this is actually acting as a guide that whether we are the right way. So this is actually providing a real-time feedback phenomena, as I said earlier. Next, we can see about the flashback chamber is completed. Then next we can see about the needle grip. So the needle grip is providing the ergonomic support during insertion. So this I would like to come closer. Yes, please see. So this is the needle grip. So this needle grip will be acting as a grip. So you, as a nurse, you should handle the device in such a way it is very sterile in nature, as well as you are not decontaminating the overall area. So this grip, you can use it like a pen, you can hold it just in your hand, single hand technique. Because we nurses, we have to do the procedure as well as we have to prevent the needle stick injury. Always keep that in mind whenever you are handling with sharp items, okay. So this is the needle grip. So you may ask me again why this grip is designed in such a fashion. So here you can see the needle which is entering into the vein, and then you have the needle grip which is just on top of the anterior portion of the needle. So this is providing an ergonomic support during insertion for the nurses, and the needle grip enhances the precision and control of the nurses, ensuring a smooth and accurate placement of the cannula. Actually, I was also very surprised during my posting when I was cannulating many of the patients. I was very overwhelmed by seeing this device. Like in olden days, where directly the patients were inserted with the needle, which is a very painful one, and always into the cannula being might be it is very causing what to say the extravasation. So this cannula is really surprising, and it is really a medical miracle that has prevented many of the complications of the IV cannula. Yes, not boring you much more. We'll go to the next portion or the next part of the IV cannula is the wings. Oh my god, what are the wings? Yes, the wings are nothing but you can see like an aeroplane wings or like a bird's wing. You can see the cannula. Yes. So these wings actually, when it comes into the IV set, you can see that it is all folded upwards, right? But during the time of insertion, we the nurses, we unfold it and we turn it into a wing, right? Are you clear now? We will be turning it into a wing, and this is how you handle the IV cannula. So the IV cannula is handled like this, right? So extending from the hub, the wing serves and anchors, and it provides stability during the insertion of the IV cannula, securing the cannula in place after successfully entered into the patient's vein. So the next is like we can see in depth, that is the valve. So this is the valve. I'll come closer. So you can see the valve over here. Yes, this is the valve. So positioned with the cannula, the valve regulates the flow of fluids, preventing the backflow, maintaining a controlled administration during the medications. So actually the flashback chamber is guiding the nurse that we have entered into the line, and this valve is actually acting as a chamber, like allowing only the fluids to enter into the vein rather than the blood being backflowing again even after connecting into the IV line, or might be medications or your blood products. So this is actually acting as a greater main mechanism, that is the valve, So we, the nurses, have to check whether the valve is tight or if it is any seal or if the valve is missing. Then it shows that the device is a default, and better you can report it to the your seniors and use a new one, right? And while reporting, see that you take out the batch number of that particular thing. So for example, if I wanted to show you, if you find any default, so you will be having the batch number over here on the IV cannula. So see that the batch number must be reported to the nursing superintendent or might be the higher authorities or pharmacy manager. So next we can see about the injection port, which is very anterior placed and next to the wing or near to the hub, which is the other port on top. So this injection port is actually, once again, yeah. So this port you can see we'll be using it into the patient's when the patient is being fixed with the IV cannula. So this is actually a dedicated site for administering additional medications or fluids or might be without disturbing the primary IV line. So this is actually enhancing the patient flexibility of care. Like we are not going to disturb the patient if the patient is on a deep sleep. You can just, in case if the patient is on IV fluids and if he needs to have any antibiotics, you can just use the adapter and close the use the chamber of the IV set and close the IV set, and then you can continue the medication dripping into the IV line by using this injection port. So this is actually enhancing a better flexibility in patient care without disturbing the primary IV line. Next, which is I would be explaining onto the bushing. So the bushing is actually reinforcing the connection between the catheter and the hub and ensuring the structural integrity, and it is preventing leaks into the patients from the IV line. It is preventing the leak, which is the bushing chamber. So the bushing is actually reinforcing between the catheter and the hub. Okay, that is the bushing. And finally comes your catheter and the needle. So I would like to explain about the catheter. So this is the only one which is going into the patient's IV line, and this is the catheter which is going to be in situ into the IV line and not the needle. So this is actually acting as a guide wire, or you call it as a guide. And once we are very confident that the patient is IV line is not having any phlebitis or there's no chances of counterpuncture, then you can directly place in this catheter. So what is this catheter? Yes, this catheter, this is a flexible tube. As you can see that it is flexibly, see, it's not going to poke the patient, I suppose, right? Yeah. So this is a flexible tube that remains into the patient's IV vein, that is intravenous line, and this is facilitating a smooth delivery of fluids or medications directly into the bloodstream. So the last is the needle. So we can see about the needle. So the needle serves as a ideal as an initial puncturing point, creating the entry of cannula into the patient's vein. So before I would conclude my topic, I would like to go on to the mnemonics, that is the IV size cannula and color coding. As I could show you, so I have only two right now to show you directly. That is the blue and the green. So what is this blue and green? You might be surprised, right? Yeah. So don't worry. There is this one mnemonic to keep in mind about the gauges. So what are these gauges? Also you are worried. It's nothing but it is providing the nurses a guide of how much fluids can be entered per minute. For example, in case if we take 18 gauge needle, which is this needle, this will be able to provide 90 ml of fluids per minute. You can purge into the patient's IV line, and generally used for blood transfusions or in case of any emergency conditions for rushing the fluids. This gauge, that is green 18 gauge Venflon, is very much essential rather than going on to the smaller side, that is smaller size, which is the 22 got Venflon, and this is mostly you can administer around 31 ml per minute. So like that you have different color codings in our daily practice. So I would like to show you a few. So that is a small mnemonic on how you can identify or how you can keep in mind what gods, what color. So this is a small structure of like a sky along with the sun and the skies, and you have the night as well as a hot air balloon followed by the deep for deciduous forest. Yes, nurses and student nurses, I hope so. Now you enjoy the video of what is IV cannula parts, and I hope so you gained the more knowledge on what are the parts of IV cannula. So I think you all will be excited on what will be on the next video. So stay tuned for the next video on what are the color codings and how to remember the color codings. Ta-da.